Uh, Hi, everyone. My name is Nancy Froman. I welcome you on behalf of the Foundation for Peripheral Neuropathy for our webinar this morning, Complementary and Alternative Medicine in Neuropathy. I'll be your moderator today. Again, my name is Nancy Froman, and behind the scenes, I have my colleagues Lindsay Colbert and Tanya Zivin, who are making sure everything runs smoothly on the back. And in the front, you've got me for the next hour to go through our presentation. A little bit of housekeeping before we begin. This presentation is being recorded. The recording link will be emailed to you in the next day or so when it comes up. So if you miss something, you'll be able to watch it then. We also house the recording on our website in our FPN Media Center, so you can refer to that at any time. We'll take questions at any time during the session, but they will only be answered at the end. There'll be a question box on the control panel of the platform that please feel free to submit your questions. Keep them general, not to your specific case, and we'll try to answer as many as we can now. And whatever we can't answer, we'll try to get back to you at another time. If you should have problems with the audio, you can always connect by phone. There's a call-in number on the registration email that you were sent. Now, to get started, I'd like to introduce you to our speaker today. Dr. Jinny Tavee is an associate professor and the medical director of the Neuromuscular Division at Northwestern University Feinberg School of Medicine. Dr. Tavee has a special interest in neuropathy as well as integrative holistic medicine and teaches meditation to medical students, patients, and physicians from all over the world. She is actively involved in researching the effects of meditation on chronic neurological diseases and has led meditation retreats for cancer survivors, as well as injured U.S. Marines returning from the Gulf War through the Wounded Warriors program. Jinny, thank you for joining us today. I'm sure we're going to learn a lot from you, and I hand it over to you to begin.
Thank you, Nancy, and thank you to the Foundation for Peripheral Neuropathy. I'm very happy to be here. Next slide, please. So I'm going to talk to you today about complementary and alternative medicine for neuropathy. Neuropathy is something that I see all day long, 8 o'clock, 9 o'clock, 10 o'clock. But when someone comes to my clinic with neuropathy, the first thing I do is I look for a cause. And the reason why is, as many of you know, if we don't find a cause, which is the case for about 50% of patients, then it's this. Here's another Band-Aid. Here's another drug, right? We're not getting to the heart of the problem. But if we can find a cause, then there's a chance to offer a target-directed approach to treatment. The second thing I do is, in many patients, I'll do an EMG, which is an electromyogram. This is an electrical study of your nerves and muscles that is not fun. And again, I think many of you know, we stick needles in you and we shock you. I don't get many Christmas cards, but it is a helpful test, and it gives us a lot of information about the type of neuropathy and how long you've had it, and if there's active nerve damage going on. And there's some other things that we do too. Now, the third thing I do is I want to address the pain. A lot of our patients have burning, numbness, tingling. They can't stand to have the bed sheets touch their feet at night. It feels like socks are rolled up at the end of the shoe. I've had some patients tell me it's like hot lava or walking on a sunburn. So I think this is an important part of the therapy, and we go through all the conventional treatments, you know, things like gabapentin, nortriptyline, pregabalin. Those are in my armamentarium, but you know, a lot of patients have side effects. You feel goofy, you gain weight, and they have to stop, or in some cases we need combination therapies. Unfortunately, again, you know this as well, it's not as beneficial as we hope. Sometimes it just takes the edge off. There was a recent study that just came out that looked at 4 different medications that are commonly used in neuropathy. This included duloxetine, also known as Cymbalta, nortriptyline, also known as Pamelor, and they looked at how much benefit they got and how many patients dropped out. Out of the 4 drugs, the one that did the best was nortriptyline, but it was only about 25% efficacious. So, I mean, it's not great, but only a third dropped out because of the side effects. So the other thing that I like to talk about in that first clinic visit is how you can use things like lifestyle modifications, meditation, Tai Chi, and of course supplements as integrative holistic therapies to address everything as a whole. And a lot of patients do get benefit, not just with coping, but some actually get a little bit of pain relief too. And this is what we're going to focus on today. Next slide, please. All right, next slide, please. So whenever I talk to a patient about integrative holistic therapies, I try to stick to 3 basic tenets. Number 1, using food as medicine, nutrition. It's the easiest thing we can do, right? Everybody eats, and you can just look at it and just see what you're eating. Number 2 is exercise. Number 3 are mind-body therapies. And again, this includes yoga, Tai Chi, meditation. Now, is supplements. And the reason why I'm not crazy about it just because, you know, you don't really know what's in there, they're not FDA regulated, but you know, patients have pain and they want something to take it away immediately, or they want a pill, right? So I will talk about it. I try to stick to evidence-based therapies only, and we're going to talk about that today. All right, next slide, please. All right, so food is medicine. The Chinese have been using this for over 2,000 years. Next slide, please. And the first major recommendation is omega-3 fatty acids. And this is found in fish, flax seeds, walnuts. Flax seeds and walnuts have the omega-6, which are converted to omega-3s. People always ask, well, do I get the DHA to EPA? You know, it doesn't matter. It can be 3 to 2, 2 to 3 ratio. Just get them. The more important thing is dose. How much should I be taking? So a good rule of thumb is about 1 gram or 1,000 milligrams. You can maybe go up to 2 grams. More than that, we know from the stroke and heart disease trials that it can cause excess bleeding. You know, if you cut yourself, you'll bleed a little bit longer. But omega-3 fatty acids are so good for many, many different kinds of diseases, heart disease, stroke. And more recently, they found, there was a Canadian trial by Vera Brill who found that omega-3 fatty acids in seal oil, I'm not sure how I feel about that, but seal oil may help with nerve regeneration. Now, this group of patients, they didn't look at pain control, they just looked at nerve regeneration, and there was a little bit of increased nerve growth at the end of the study, which was at 1 year. The major side effect, of course, was very minimal, meaning it didn't cause you to be cognitively impaired or gait imbalance as we see with the other drugs, but it did cause weight gain, about 6 kilos in 5 patients. Next slide, please. All right, the second most important recommendation is get your fruits and vegetables. The American Heart Association, American Cancer Society all recommend 5 servings a day. And a lot of my patients think, oh, there is no way I'm gonna do that, right? It's not that hard. For breakfast, you can have a banana and maybe some blueberries. At lunch, have a side salad. And then maybe in the afternoon, you can have a snack, maybe an apple or an orange. And then at dinner, then you can have a thing of vegetables, and that's 5. And of course, the more you eat, the better it is for you. Now, for my diabetics, you got to be careful about the fruit, but there's no limit for vegetables. The ones you choose are the brightly colored fruits and vegetables, things like berries and avocado, broccoli. The antioxidants and all the good stuff is in the pigment in the skin. One last push for berries, and you don't have to get the fancy acai berries. It looks like ACAI, but it's acai. You just get blueberries. There was a study many years ago done in mice where they had an older group of mice and a younger group of mice, and they fed the older group of mice a blueberry chow, and they fed the younger group of mice just normal chow. And they, after a while, they put them through this water maze. Some of those older mice outperform the younger mice. And one of the reasons maybe is that it might have a chemical similar to Aricept, which is a medication for Alzheimer's now. So something to think about. And I did have my blueberries this morning. All right, next slide, please. All right. The third recommendation I make about nutrition is nuts. Nuts have minerals, vitamins, essential fatty acids, very powerful antioxidant. One of the big ones is walnuts. This actually has omega-3 fatty acids in the form of omega-6s. And I read somewhere that one small serving of salmon has the same amount of omega-3 fatty acids as a quarter cup of walnuts. It helps with your cholesterol. Cashews have copper, which is good for the brain, the spinal cord, and the nerves. You need copper for your nerves, for sure. Magnesium is the other one. Magnesium is good for the brain and the muscles. Brazil nuts have selenium. I always pick these out of the cocktail mixes, but Brazil nuts have selenium, which is a powerful antioxidant. They were looking at this for prostate cancer, the selenium. Almonds, very, very common nut that we see all the time, but vitamin E, which may help with Parkinson's disease, calcium, it's just good overall. There was a study, it was a Harvard nutrition study looking at patients with Parkinson's, and they found they split them into 3 groups. One group had vitamin E rich foods, okay, like almonds. Another group had just the vitamin E pills, the supplements you get online. And the last one had just a regular diet, no increased vitamin E. And they found that the patients who ate the vitamin E rich foods had a reduced risk of Parkinson's compared to those who had the supplement. Even the ones who had the supplement, they were the same as, you know, taking nothing. So if you can, get your vitamins from real food, okay? Rather than a pill. You just absorb it better. And you really don't know what you're getting. These are not FDA regulated. So it can say it's, you know, 1,000 international units, but it may not be. You don't know. The other thing is pistachios. Pistachios are known as the skinny nut. These have lutein, which are good for your eyes, and B6. A quarter cup only has, I think, 160 calories, 120 or 160 calories. And then finally, so there are lots of different kinds of nuts. Try to eat raw. You don't want the honey roasted Cajun spice Thai chili, right? They have a lot of extra ingredients, so just get the raw nuts. And then the second point I want to make is be a little careful. They are high calorie foods. So for instance, when I heard about walnuts and omega-3 fatty acids, I was so excited. I was eating walnuts all day. I was snacking on them in the morning, in the afternoon, in the evening. And then after a month, I got mad at my dry cleaner because I said, you shrunk all my pants. And I realized, nope, it was the walnuts. So now I eat almonds and pistachios. But walnuts are good for you in moderation. Next slide, please. All right, another recommendation, especially for patients who are trying to lose weight, go gluten-free. This does not mean gluten-free pretzels and gluten-free cake and gluten-free cookies. This means try to cut carbs, refined carbs, so bread, pasta. Yes, rice doesn't technically have gluten, although sometimes they process it with flour. Brown rice is still good for you, has a lot of good vitamins, but if you really want to lose weight, just cut it. And I don't know why. My men patients, they just drop weight like that. The women, they just look at their husbands and grr. But you can lose weight if you just cut carbs. You don't have to go keto or whole day 30. Just don't eat bread, and you will see a difference. Quinoa is a South American super grain. It looks like quinoa, but it's pronounced quinoa, and it's got 6 grams of protein. It looks like a smaller couscous. It's just a grain, and it's very good. Teff is used in Ethiopian cooking, but you can see here it's a grain that they use to make breads. It's very good. Buckwheat is also very healthy as well if you want your buckwheat pancakes in the morning. But as I said before, if you want to lose weight, I would just cut all carbs. So fish, chicken, lean cuts of red meat if you have to have it, fruits, vegetables, nuts, that's what I recommend. All right, next slide, please. And here are some other recommendations with respect to nutrition and intake. So alcohol. Alcohol is one of the most common causes of neuropathy. And for many years, there was a debate. Is it the alcohol itself, or is it the nutritional deficiencies that some alcoholics may have? It's the alcohol, okay? So you do have to drink a significant amount, but if you're trying to heal your nerves, I would say cut it. Now, I'm not telling my patients, especially those who have wine collections or they love their beer. I had a crafter, I forget what they're called, but he crafts beer, and he's like, I don't know about that. But it does make a difference. I've had a number of patients tell me that when they stop drinking or they cut it considerably, it really did help with their symptoms. Cutting sugar, artificial sweeteners, and this is a really nice point. Start looking at the ingredients of what you buy. If you can't pronounce it, don't buy it. Try to have things with real ingredients. And this one I found out the hard way, but so there are a lot of things that are good for you. So kale, cauliflower, chickpeas, all of these things are good for you, right? Eat it in moderation because they contain enzymes that sometimes you can't break down. And so you end up bloating, right? And you look down, your stomach's out to here, you're thinking, I could have gotten the same effect with chocolate cake, right? So just don't eat it if you can't digest it, or eat it in small amounts. And then finally, local versus organic. This has been a controversy. Which one do I get? So I used to live in Cleveland. I lived in Cleveland for almost 20 years, but before I came here. But it is hard to get good local produce in Cleveland in the winter. I think we had cabbage, right? So, you know, if you live in California, that's great, but it's tough. I try to buy local when I can, and organic, that's tough too. I mean, it is expensive. I do not want to pay $5 a pound for apples, right? But it does make a difference if you can afford it. More than anything, I just tell my patients, just eat fruits and vegetables. If you can get it, wash it really well and do the best you can, right? But if you can afford it, that it would be good. And the reason why, there's a new component or a new pesticide, they have neonicotinoids. This is controversial, but it's not just the skin, right, anymore. You can't just clean it off anymore. These new pesticides, it's in the seed. So the entire fruit from the inside out has pesticide. Again, it's controversial, we don't know, but this is thought to be environmentally harmful. They think that this is why some of the bees in Europe are dying, but some of the studies are conflicting, so I can't be sure. And there may be some neurologic effects of pesticides in general. Next slide, please. So I saw this in a presentation several years ago, and I found the actual paper. There was a study in the Yaqui Valley in Sonora, Mexico. And what they did was they looked at two agricultural societies, okay? One was in the foothills and one was in the valley, and they both produced crops. And one year, the people in the valley said, well, we want to increase our crop production, so we're going to start using pesticides, right? The people in the foothills said, no, we're going to stick to our traditional farming methods. So after a while, you know, this person was using pesticides, these people were not. These investigators came in to talk to the children, and they wanted to see if there were neurologic effects of the children. And so what they did was they asked these little 3 to 5-year-olds to draw a picture of a person. And you can see here on the this side, I know what side it comes to you, but on the left side, so you can see there's a person, right? He's got a face, he's got a tummy, and you can see all throughout the left side of the picture. On the right side are the people from the valley. These are 3 to 5-year-olds. You can see they do not look like a person. And what they found was physically they looked fine, right? There was no growth retardation in the valley population, but they didn't have the concentration, they didn't have the hand-eye coordination, so they felt that there was an effect from the pesticide use. Next slide, please. All right, now, what kinds of specific diets have been recommended for neuropathy? So there were a couple of studies, not many, but a couple of studies that showed that vegetarian diet plus exercise, so they didn't combine it. I mean, they didn't isolate it, but vegetarian diet and exercise did help pain in 17 of 21 patients with diabetic neuropathy. A second study found that a low-fat, plant-based diet, now remember, B12 is only in meat-based products. So if you're doing mainly plant-based diet, you should be taking B12 supplements. And B12, I'm sorry for this segue here, or I mean just this little aside, but B12 is a very common cause of neuropathy as well. Make sure that your doctors check you for that, and you may need to add a couple more markers called homocysteine and methylmalonic acid, which is a more sensitive, a better marker of B12 deficiency. And the reason why is it's not just being a vegetarian, right? What blocks B12 absorption is a drug called metformin, which is used in diabetes, and another whole class of drugs called proton pump inhibitors and other kind of stomach acid blockers that many people take now, like omeprazole, which is Prilosec. So that blocks your ability to absorb B12 because you need gastric acid to absorb B12. So just look at that, make sure your doctors are checking it. So anyway, this low-fat plant-based diet with B12 plus weekly education classes also help with pain and weight loss and maybe some of the nerve diagnostic testing findings. All right, next slide, please. All right, this is late breaking. It just came out maybe in the last year. There was a large analysis of many different kinds of vitamin D and neuropathy studies in type 2 diabetic neuropathy studies, and they found that in those patients, over 2,000 patients who had type 2 diabetic neuropathy, those who had a reduced vitamin D level did worse, had more pain than those who had a normal vitamin D level. Now, they're not saying it's a causative issue yet, right? We don't know if it causes more pain, but they're seeing that a low vitamin D does correlate with increased pain. Now, we have to be careful though. So a good level is 30 or more, but you have to be careful. So African Americans, Hispanics, Asians, people who have pigment in their skin, the vitamin D level that's measured in our blood may not be as accurate as patients who have lighter pigments or Caucasian. And they have done studies where African Americans and Hispanics who have low vitamin D levels actually have normal appearing bones on specific testing. So we're not quite sure. Just, again, try to get sunlight, especially during COVID, eat vitamin D rich foods, and if you need to, get your vitamin D by supplement. Next slide, please. Exercise. Exercise, exercise, exercise is my patient's saving grace. This really makes a difference. And next slide, please. So I was at the Cleveland Clinic for many years before I came to Northwestern, but at the head of neurophysical therapy there is Matt Sutliff, and he told me this. He said, there are 4 rules of exercise for the neurologic patient who wants to get better. And the #1 rule is pick something you like or you can tolerate. So we all know what's the #1 month that everyone joins a gym? January. What's the #1 month everybody quits the gym? February, right? And the reason why is, we do something that we don't like, we're not going to enjoy it. So you've got to pick something you think you can do, okay? I don't care if it's Zumba, or jazzercise, or aquatherapy, or running, whatever you can do. If you like it, you'll do it. The second thing, and I think that for many of my patients, this is one of the most important rules, and I use this all the time for all kinds of patients, not just neuropathy patients, but it's called the 2-hour rule. A lot of my patients always say, well, how much is too much? How much can I do? How much do I know that I need to cut down? The only person who can know this is you. And the 2-hour rule comes in handy because wherever you are, let's say that you do the elliptical, okay, for 15 to 20 minutes. If you feel worse or tired at the 2-hour mark after you've done the elliptical, that was too much. You need to go back and modify that or reduce the minutes you're doing, because at 2 hours after we work out, we should feel refreshed or neutral. Okay, and actually a lot of my surgeon friends will use this for their patients who are recovering from surgery, 2-hour rule. #3, try to do something every day. I have some patients who are quite disabled from their diseases, and they'll walk around the house, they'll furniture walk if they have to, or they'll just walk out to their mailbox, walk around their block. Whatever they can do is fine. Just do something. Get up off the couch. And #4, for my neurology patients, doesn't matter if it's neuropathy or anything else, I tell them no pain, no gain does not apply. All right, if it hurts, stop. it's not going to help you, and you're going to pay for it the next day. All right, next slide, please. All right, so what are we recommending? So the number one cause of neuropathy is diabetes and the metabolic syndrome. So metabolic syndrome is pre-diabetes along with abnormal cholesterol panel, high blood pressure, and increased abdominal girth, meaning you're a little bit overweight. And so what they've recommended in terms of how much exercise is 150 minutes per week. But by the way, so when I talk to patients and I tell them, I give them my spiel, oh, you have a neuropathy, do you know what the number one cause of neuropathy is? And some people do, they're like, oh, it's diabetes. But I was telling a man, he was in his 70s, and I said, and they always think they're the only one. Neuropathy affects, 25 million people in the US. And I say, well, do you know what the number one cause of neuropathy is? And he looked at me dead in the eye and he said, marriage. And I said, good guess, but no, it was diabetes. So anyway, what they're recommending now is 150 minutes a week for metabolic syndrome, but I like to extrapolate that to other causes of neuropathy. So however you want to do it, you can do the math. 50 minutes, for 3 days, 30 minutes. A lot of people think that 30 minutes 5 times a week is helpful. And what kind of exercises can you do? Well, it depends, right? If you love to walk, that counts. We obviously want to get your heart rate up, but if you can't do it, you can't run or swim or bike or do the rowing machine, then walk fast or just do what you can. We'll take it. But some of my patients, it's too painful to walk. They like walking, but they can't. So the other types of therapy that, especially my older patients, I'll tell them to do is aqua therapy. There are many different kinds of aqua therapy. There's shallow water therapy where you're there, you're standing in the water, you're just kind of doing things. And I know it's COVID, so right now it's not a good time, but when things start to open up, that it could be helpful. The other one is the deep water therapy, and that one you can get your heart rate up. I actually did this. I like to do all these different things so I know what my patients are feeling, what they're going through. So I went to a senior citizen center and I got one of these noodles, right? It's like this floaty thing, and you wrap it around you and you get into the deep part. So I was there with these 70 and 80-year-olds. We had 50s music, right? And then the instructor was teaching them. And we were doing things with our legs in the deep water like this, right? Bringing our legs together, bringing them apart. And I was huffing and puffing. They're all singing and laughing. They're enjoying it. And I have to say, are we done yet? Are we almost done? But it's a good workout, and you can choose which level you want. And of course, the recumbent bicycle. This is the low riding bicycle that's very close to the ground. I like it for my patients who don't have balance because you don't have to worry about falling. It's so low to the ground, you just kind of like roll out. So it's relatively safe, and my patients like it, and you can adjust the resistance, you can do things so that you get a good workout. Next slide, please. All right, so what can exercise do for you? Besides the fact that it clears your head, there has been some data that shows that it might help regenerate nerve fibers, especially in patients who have the metabolic syndrome, that pre-diabetes syndrome. And also it can help with diabetic neuropathy. So exercise, exercise, exercise. I can't say that enough. Next slide, please. All right, supplements. And I talk about this because my patients love it. So next slide. So there are the number one, I try to stick to evidence-based, but the one with the most literature behind it is probably acetyl L-carnitine. Now, acetyl L-carnitine, we have this in our body. We already make it, but people take it 1,000 milligrams 3 times a day was the dose that was seen in studies looking at diabetic neuropathy, HIV neuropathy, chemo-related neuropathy, and that seemed to help a little bit. Is it a game changer? No, not really, but it can be marginally helpful in the pain, and it can maybe cause nerve regeneration. Alpha-lipoic acid, I actually heard the original guy who did, I actually heard the guy who did the original studies at the FDA, and he was talking about alpha-lipoic acid. He's German, and what they were doing is 600 milligrams IV, and that was working like a charm. But I think that, I don't know, the German insurance companies, whatever they're called, Blue Cross Blue Shield, Germany, I don't know what it is. But anyway, the point though is that they found that it was too expensive. So they said, nope, we're not going to cover it anymore. So we said, well, what do we do for orals? We said, well, why don't you just do the same dose, 600 milligrams orally? It's okay, but I have some patients who take both acetyl L-carnitine and alpha lipoic acid in conjunction, and they said it provides some relief, so it's something to think about. Glutamine, this is something that used to be, it is still recommended for patients who are about to undergo chemo, and it might be protective for the nerves, things for breast cancer or colon cancer, and they'll take it right before they undergo chemotherapy. However, I've had a couple of patients that actually got relief from the glutamine after they developed the neuropathy. So it's something to think about. Now, Juice Plus. Juice Plus is one of these vitamins you can get online. It's kind of like Amway, right? Or some kind of online thing. I don't have any stock in it. I've never bought it, never seen it, but I had 6 patients tell me in a 5-month period how fabulous Juice Plus was for their nerves and their muscles. So I include it here because patients do tell me it works. It's a little expensive. It's about $40 to $50 a month on top of everything else, but it's so popular that Costco makes their own version. It's called Juice Festive, and it's only $17, or it was a couple of years ago. Curcumin is the new wonder drug, right? But it came out about 5 years ago. We saw it in the newspapers. But the thing is, so curcumin is, it's a yellow spice. It's also known as turmeric, and you'll see it a lot in Indian cooking. You have to eat a lot of it, though. It's not just what's in Indian cooking. But the curcumin, you really have to go to a compounding pharmacy to get the pure stuff. It is very expensive. There was one compounding pharmacy that charged $90 a month for the capsules. They gave me a free sample. I felt so guilty. I was like, no, I don't want to take this. But the owner of the pharmacy actually said, oh my gosh, it helped with my nerve pain in my arm. So he believes in it. Something to think about, but again, it's very pricey, and you should go to a compounding pharmacy for this. We talked a little about omega-3 fatty acids. Glutathione. So for many years, they were trying to see if it was protective for patients who are about to undergo chemotherapy. And there were little studies that said, yeah, it's protective. But then there was a larger study that said, it was a bust. Having said that, I do have one patient who's a very active guy. He's a dentist, brilliant guy, and he has a very rare form of neuropathy. It's actually very, very severe, and he was not able to walk very well at all. I mean, he was weak. It was pretty bad, and he tried all these things, and he finally tried glutathione. It was like the Lazarus effect. He did so much better, and he maintained on that for years. And I just saw him maybe a couple months ago, and he was still doing relatively well, still practicing. So something to think about. There's not enough data to give you a good recommendation for dose, but I'm sure you can look online. There's not enough to recommend probiotics for now. I don't see anything bad about it, so it's something you might want to consider. Next slide, please. All right, so for patients who don't want to take anything, you can always do topicals. You can do hemp cream. I have patients who like Vicks Vapor Rub. I have this 75-year-old man. His girlfriend, right, wipes the Vicks Vapor Rubs all over his feet. He said, oh, I like it. It feels so soft. Horse liniment cream. I've had a number of patients tell me about that. Tiger Balm. It's the menthol component. Now, some people, it makes the neuropathy worse, but sometimes it just burns it out. Frankincense essential oil. The first time I heard about this was maybe 2009, 2010, and it was this woman who came in with high heels, right, and she had neuropathy, and she came in, she's like, oh yes, the frankincense works like a charm. And I said, frankincense, really? What about gold? What about myrrh? But in all reality, in all honesty, I actually did a literature search recently, maybe 4 years ago, and frankincense is a thing. They did a study in mouse models, and they found that it actually modulates some of the, I know it's going above and beyond, but the thing is, it modulates some of the channels that are involved with pain in the nerve, and they found that these patients, these mice with neuropathy, did better with frankincense oil, and they put the oil on their little feet. So it might be something. There was a study that looked at all the reviews for Chinese herbals. It was a bust. It did not work, so I would not do that. Next slide, please. All right, and so there was a recent review. It just came out. This is possibly, so this isn't even out yet, hasn't even been published yet. These are the recommendations from the American Academy of Neurology. What they did was they reviewed a lot of pain medications, and they sent it out to the neurology community to look at before they actually publish it. But what they did find is that ginkgo biloba, 120 milligrams per day, was possibly more likely to be helpful for pain. However, what was not found to be helpful was nutmeg aspic, Metanix, which is I think some of you may be on it, it's a combination of vitamins, and tocotrienols, which is a form of vitamin E. It's got compounds in vitamin E. All right, next slide, please. All right, medical marijuana. So I gave a talk like this to the Foundation for Peripheral Neuropathy, I think 3 years ago, 2 or 3 years ago. And I was trying to talk about exercise, nutrition, how that can help you. They didn't want to hear it. They wanted to hear about medical marijuana. And I'll tell you, I have my own personal feelings about marijuana, but it is a game changer for my neuropathy patients. And the reason why is there's a compound called CBD, which is one of the active compounds of medical marijuana. And you actually have CBD receptors on your nerves and your brain. And so there may be something happening physiologically when you ingest marijuana. And the thing is, it's not just playing Jedi mind tricks on your brain like a lot of the other drugs that you're taking. So it might be doing something. It's not curing you. It's not changing the neuropathy, but it might be doing something at the local nerve effect. And it's been found to be helpful in a number of types of neuropathy, including HIV and diabetic neuropathy. But the clinical trials aren't great. I mean, how do you blind a marijuana trial, right? And then there's a flip side. 9% first-time addiction rate, definitely causes some cognitive issues. There was one study that looked at the neuropsych effects, and they all did poorly in the after group after they've been on the marijuana. And it's illegal. I mean, yes, you can do CBD, but the thing is, your employer can fire you if it's not accepted. So you just got to be careful because it's not federally regulated. But I will. So again, I have my own feelings about it, but I will talk about it the whole day long with my patients. I have one patient who gets the gummy octopus. So the gummies are probably the best. I do not recommend smoking. We don't have enough long-term data now, but I have one guy who eats one leg of his octopus at a time, and when the pain's really bad, he'll bite the head off. All right, next slide, please. All right. Last but not least is my favorite. My passion is mind-body therapies. Next slide. So this includes yoga. Now, I know some of you can't do the 19-year-old, look at what I can do yoga. Restorative yoga is probably the best. You lie down on the floor and you do these meditative exercises with the instructor. Meditation, there are many different kinds of meditation. There's the sitting meditation where you focus on your breath. Or there's Tai Chi, which is a movement meditation. It's a Chinese movement meditation that's actually based on martial arts. So everybody knows cloud hands, right? I don't think I'm doing it right. But anyway, it's like this, right? It's very peaceful. You see these 9-year-old women from Hong Kong doing it in the park. And then, but if you do it quickly, it's a defense move. And I had one patient who was the CEO of a company, and he had neurologic issues and he couldn't be the CEO anymore. And I told him, why don't you do Tai Chi for your balance? I think it's going to help. He's like, no, I was a big skier. I was the CEO. I'm not going to do Tai Chi. He now teaches Tai Chi for people. So it's very interesting. Qigong is a more dynamic form of Tai Chi. Again, it's a Chinese exercise, and that has been helpful for pain. Mindfulness meditation, which we'll talk about. Feldenkrais. This is a series of exercises and therapy exercises that I've actually done. I did it with my friend. And again, very gentle exercises where you do stretching things, and some of it's done on the floor. And then, of course, Pilates, if you can handle it. Next slide, please. All right. And then mindfulness. We hear about this all the time, right? It's in the offices of Google and LinkedIn and in the US military. But what does it really mean? What does mindfulness or being in the moment really mean? Next slide, please. The best description of mindfulness or being in the moment that I've ever heard came from a man who told me he died. I was doing an EMG on this guy, and we were just chatting, and he said, you know, I died, right? And I was like, I'm sorry, come again? He goes, yeah, I died last year. And I said, What do you mean? So apparently he was an executive. He was playing tennis at the club with his friend. When when they were done, the friend went home. He walked into the clubhouse and dropped dead on the ground. A nurse who had been playing tennis on the court nearby came in right behind him, just coincidentally, and saw him drop to the ground. She ran to him, started CPR, felt for his pulse, started CPR. The clubhouse attendant saw that too, grabbed the defibrillator off the wall, and they brought him back with a defibrillator. They life-flighted him over to the hospital. Cardiologist, he had had a heart attack. The cardiologist opened up his arteries, put in a ton of stents, and he woke up 4 days later. And I said, wow. And he goes, and I said, did you see a light? I was just curious. I said, did you see a light? He goes, yeah, I don't remember anything, but I remember seeing this natural blue-green light. It was very calming, very peaceful. And I had this sensation of ascending. I felt like I was in a plane and I was coming up and I could see the tops of houses. And that's all I can remember. It was the feeling of ascending. And then I woke up. And ever since then, my life has never been the same. I enjoy every single moment. And I said, really? You enjoy every single moment? And he said, yes, I do. I said, you enjoy standing at the line at the grocery store? And he said, well, no, I don't enjoy it, but I don't mind it. And that's what being in the moment is. That's what mindfulness, being right there wherever you are and not minding it, not coming up with all these thoughts. I can't believe I'm in the grocery store. You know, this lady's playing with a check. I gotta be somewhere, right? All these thoughts. It's not there. You're just there. And that's what being in the moment is. That's what meditation helps you do. You learn to just be whatever it is, and you learn to be with the pain instead of being defeated by the pain. Next slide, please. So what is the evidence for mind-based therapies for neuropathy? So mindfulness-based stress reduction is a formalized meditation practice, and it's kind of intense. It's a several-week course, but they found that it did help with diabetic neuropathy. Mindfulness meditation, where the patient did it on their own with a guided CD, did not work, but Tai Chi helps. And we did a study many years ago when I was in Cleveland with my mother, who's a Buddhist monk. We brought her in from Thailand, from the rainforest, and she taught meditation to patients with neuropathy and multiple sclerosis. And we did Tai Chi, Qigong, sitting meditation, and they did well. They had improved pain and quality of life scores. So next slide, please. So meditation, well, how do you do it at home? So the type of mindfulness meditation, what you do is you can sit on a couch, sit on a chair. You do not have to sit on the floor and torture yourself. What you do is you focus, okay? You can focus on the breath right here or right here in your chi. You can focus how the diaphragm goes in. When a thought comes in your mind, you see it, okay? And then you don't get involved with it. You don't let it go on and on and on. And then you let it go. You disengage, you step away from it, you zoom out, and then you go away. And then a thought will come in again. You do the same thing. You see it, let it go, all right? And if you're in the car, and if somebody cuts you off, before you give them a lovely finger gesture, take 5 deep breaths. This works. There was a late meditation master, Ajahn Tawar, who used to teach this to cancer patients. So you take 5 deep breaths like this, 5 deep breaths, and it resets you. Mindfulness with walking, no earbuds, no iPhone, no friend, no dog, no spouse. You walk by yourself, you walk quickly. Things are going to pass by you. People are going to pass by you having conversations. You're not going to turn around and follow them, right? Or the wind passes by or a truck goes by. You don't follow them. You just let them go. And this is an approximation of what we do with our thoughts. We just let them go. And then finally, for those of us who are stuck at the desk, who are doing Zoom conference or working at a computer, if you're getting overwhelmed, get out of your head. And the way you do this is to shift your gaze. Look out the window. If you don't have a window, look at the corner, look at the ceiling. Just that brief shift in your gaze will shift your thoughts. It's like a personal control alt-delete to reset. Next slide, please. Okay, and so what are some resources? You can go to the Y. I did Tai Chi at a community health center in Cleveland. I have a teacher here. You can do books about meditation with CDs. I wrote a book for my patients called The Last Day of Suffering. It's got nutrition, exercise, mind-body therapies, and some things about being kind and giving. So I wrote a book as well. You can do the mindfulness-based stress reduction. Those are a little expensive, but they're intense. And if you have other issues you want to work out, it might be good for you. And then there are meditation retreats all around the country that some are free. And I've done a couple of these and some do cost money. Next slide, please. And this is my last slide. So currently we're recruiting for my study. We're looking at Qigong, which again is this Chinese exercise for patients with painful diabetic neuropathy. You have to have diabetes. And right now we're in the middle, but we need 6 more people. But I've got 2 teachers and it's Zoom. It's a Zoom Qigong. And then we set you up and you can have potentially a private lesson or a group lesson. And they teach you how to do Qigong, and we're gonna see if Qigong helps with painful diabetic neuropathy. And the beauty of it is you never have to come in, right? It's all Zoom. So this lady that you can see here, that's a woman Buddhist monk. She is a family friend of ours. She is a chaplain at Stanford. And she works with hospice patients, so she's been doing Zoom Qigong for quite a while. And she's got a couple of patients right now in the study, and they love it. And then the gentleman you see there is my Tai Chi teacher, Chris Cinnamon. He's the head of Chicago Tai Chi here in the city, which is the biggest Tai Chi society here. And anyway, he teaches Tai Chi as well. So they're both of our teachers, and they're both fantastic, and they're both great. And again, the patients love it. We would love to hear from you. So if you're interested, let us know. But I think that that's my last slide. And I'm sorry, I think I went over just a little bit, but we still have time for questions. Thank you so much for having me.
Jinny, that was terrific. Thank you so much. I learned a lot, and I'm going to look into some of the Qigong myself and meditation, so that's terrific.
Great.
We do have a lot of questions, and let's see what we can get through, but your information was so helpful. The first question that a lot of people asked is that you focused a lot on studies with diabetic peripheral neuropathy. These recommendations are good for any kind of peripheral neuropathy, isn't that so?
It's good for everyone, period. It's good for everyone. The reason why I didn't mean to focus on diabetic neuropathy, but that's where most of the studies are, right?
Okay, great. Then a couple of questions that came out about the nuts. How much should people eat, and what's a good range to say on a daily basis or a weekly basis, so we don't have to buy new clothes?
So assuming you're not allergic to nuts and you don't have family members who are allergic to nuts, I would say a quarter cup each day, which is a handful, but not more than probably half a cup a day. You're going to start to look at weight gain. So just start out. And then my mother, she broke her tooth on a nut. So you've got to be careful if you've got brittle teeth. So I still like the pistachios, but whatever floats your boat.
Okay, great. Well, that's helpful. Then for the omega-3s, if people are vegetarian, what can they take? Can they take algae oil, or are there other supplements that are okay for vegetarians who don't want to get it from fish oil or salmon?
So omega-6, you can get the omega-6,
Okay.
and that's flaxseed, that's walnuts. There are alternatives. And I think, I don't know enough about algae and seaweed, but you can look into that as well. One quick thing, flaxseed, it's still, I don't know, it's still controversial if it has anything to do with prostate cancer, right? If it may increase your risk. So for my male patients, be careful about flaxseed.
Okay. And that was one of the other questions. For the supplements, um, is there something that people who have CIPN or cancer or have other issues that they should avoid certain supplements or avoid certain things, or is that better talked with your doctor, or what would you recommend to people who may have other issues?
For my chemo patients, for my patients with cancer who are undergoing chemo, definitely need to talk to your doctor about it. Most of the supplements should be fine, but you don't know. As I said before, you don't know what's in them, and I don't want them to interfere with your chemotherapy. For chronic, the idiopathic one where we don't have a cause, it's probably okay if you don't have any other issues. Some things like ginkgo biloba, and I think that that's correct, in high doses, it can cause elevated blood pressure.
Okay, great. And what about could you repeat what other studies people should take for the B12? It was went by quickly, and a couple of people asked what they should ask for again. You had mentioned that.
Right. So there are two markers that may be more sensitive to a B12 deficiency, and one is called homocysteine, and your doctor will know these, homocysteine, and the second one is called methylmalonic acid, or MMA. And these two things are upstream in the metabolism of B12. So if you're having B12 deficiency, they will be higher because the B12 is not being used they're not being used to absorb the B12.
Great. And then what about acupressure and acupuncture?
So that's a great question. I've had a number of patients tell me over the years that acupuncture did not work. Did not work. Pressure, eh. I don't know. I don't think there's been enough literature, but acupuncture usually does not work for neuropathy. It would be less common than it would be to help. Less common
Okay.
for it to help than to
Then,
not.
okay. What would you say about caffeine? Is there an implication between caffeine and peripheral neuropathy?
Not that I've read. Not that I've read.
Okay, well, that's that's helpful, I guess, for some people. That's good. And for uh, like for the numbness rather than the pain, is there anything a patient can do for that?
So that's a great question too. So a lot of patients don't actually have the pain. They feel like their feet are dead, right?
Yeah.
Like your feet are wood. And the biggest complication for that is gait imbalance. They are very unsteady when they walk. And when they walk around the house, they'll step on something and then they'll bleed because they won't know, right? They'll get blood all over the carpet and their wife will yell at them. I've seen that too. But for those patients, exercise can help if you can do that. The supplements, and this is what I try to hammer home. I can give you a truckload of gabapentin, but if you have numbness, just
It's not
numbness,
gonna, right.
it's not going to help, right? So I think that maybe in these cases, the supplements that can help with regeneration of the nerve might be helpful. If you're not shooting for full sensation, right? I would do the nutrition, the exercise, and obviously things like the acetyl L-carnitine and then the omega-3 fatty acids, which have a little bit of literature to support marginal regeneration.
Okay, great. And I'm looking at the questions that are coming in here. How about like some of the vibrating machines? Are any of those helpful?
So a few of my patients like that. I know they're talking about the TENS unit, right? It's like
Yeah.
the sensors, and then you put it on your feet and then you turn it on. Yeah, I've had a number of patients tell me that it helps. It's not, like I said, it's not great, but for the time that the electrodes are on your feet, it can be
It
helpful.
can be helpful. Okay. And the back on the medical marijuana, is CBD versus THC, is there any difference? What should patients be looking at for those discussions?
Sure. So the two main active ingredients that many people know about is CBD and THC. THC is the one that can get you high, right? And so for a lot of my patients who have never tried marijuana, when they were young or are afraid of getting high, then I tell them to stick with the CBD, right? And these are the ones we know about, the CBD receptors on the nerves. So, but I have some patients who like the THC and they think that the combination does help. So you just have to be careful. And then you don't really know how much you're getting, right? I've been told that you can get, even in a pure CBD, you can get anywhere from 0 to 3% THC. And you just go to a dispensary and hopefully you'll have somebody knowledgeable who can help you. I don't recommend, as I said, no vaping, no smoking. We do not know long-term effects yet. The gummies, the edibles, the tinctures that you put on your tongue. I have one 93-year-old who loves the CBD oil on her feet. She'll put it right on her feet. She doesn't eat it. She just does that. But I would say the gummies, the chocolates. I even have one woman who has CBD butter, right? CBD butter. She puts it on her toast every morning. And I'm thinking, what if somebody else got into that butter? They would say, that is the best toast ever, right? So you just have to go, and it's a crapshoot. It's going to be
Yeah.
trial and error. Some things are going to work, some things aren't. Just be patient if you want to do this.
And is this something that would the medical marijuana also you be discussing that with your doctor as well? Is that you do hand in hand with your other? your other medications and treatments, I would imagine.
Yes, yes, correct.
Okay. All right. Somebody asked, I don't know anything about this, a supplement called TRU Niagen. Do you know anything about that?
I don't know a lot of these trade names. I only
Okay.
know by the actual active ingredient.
Okay. Yeah, I'm not familiar with that either. We'll have to follow up on that one once we figure out what that is.
Sure.
And then what about ginger?
Ginger, I haven't seen any effect of ginger on neuropathy itself, but I've seen some good trial studies, not good, I mean, okay studies about ginger and migraines. It helps with the nausea that a lot of people get with migraines, and ginger is just good for you, right? You can
Right.
put a little ginger in your cooking.
Right. And then this will be the final question because we've gotten so much information. It was terrific. Um, how long do you give for a supplement or an exercise or a treatment to work? Do you take it, does it take a week, a month, first time? What do you, how patient or impatient do we need to be if we're trying some of these?
For the supplements, I use what I tell my patients about the pain medications like gabapentin and nortriptyline, which are probably my favorites, the gabapentin and nortriptyline to start out with. Again, I have no stock in this. I don't get anything from the company, but I give it 30 days. Just give it 30 days, sometimes 60 days, but after a month or two, if it's not working, call it a day. These are expensive drugs. And I heard once that from Stanley Fon in Columbia, I heard him in a talk, I said, the biggest side effects of a lot of these supplements is poverty because they're so expensive. So it's something to think about. Now, in terms of exercise, you got to keep trying, right? The nutrition, you got to keep trying. For my patients who I tell them to cut the gluten to see if it makes a difference, right? I tell them, one, you really have to be gluten free. You can't, it's like being pregnant. You're either pregnant or you're not. There's no in between. And for my gluten patients or the people who are going to try to go gluten free, I say try it for at least 4 to 6 weeks or whenever you think you're about to come and kill me for making you go gluten free, right? You can stop at any time then. But for exercise, just keep trying. I'm not looking for, oh, I'm not better yet. It doesn't matter. Exercise should help for so many other things. And you may not see a difference there right away. It may take 6 to 8 weeks, but keep doing it.
Great. Well, I think we are just about time. This has been terrific. We may have some other questions that come in. We may follow up with you. There was the email address you gave if patients are interested in the Qigong study,
Mhm.
which I'm sure there'll be a few that would like to participate. And
Right.
and I thank you. Do you have any final words you would like to impart to our audience before we give our summary and say our goodbyes?
Sure. So for a lot of patients who don't have a lot of information about neuropathy, they think they're going to be crippled. They think they're going to be in a wheelchair. For most patients with just numbness, pain, burning in the hands and the feet, you're not going to be crippled. For most people, you're going to live your life, all right? It's not going to kill you, but it takes away the quality of life. And I get that. And that's what we're trying to do. We're trying to make things better.
Okay. Thank you very much, Jinny. This was great. And uh, there's so much information here. I'm sure people will be asking more questions and hopefully get some more answers. So again, thank you for watching. Thank you for taking the time, everyone. If you like this webinar, please let us know. You'll see a survey at the end of this session with your responses and some suggestions for us. We try to provide more and more of our webinars, educational programs online like this one. If you like what you saw, we'd love to have you continue to support us. It's every dollar helps us to continue to provide our programs and advance our mission, and we're appreciative of everything. And if we ever can help you with anything, let us know, either email or call us. You should be getting an email from us with the recordings from today, and we'll try to follow up on any of the questions that haven't been answered. And again, thank you for your time. Thank you, everybody. I appreciate you being with us. Till the next time, bye.